Hi, Isabella. I'm glad you came in today. So before we begin, let's do our usual check-in. How are you feeling?
Not too good, really overwhelmed and a little frantic about work and the kids.
Oh, thank you for telling me. You know you don't have to manage this alone, right? We'll take this one step at a time together. Can you tell me what's happening that led you to feel like this?
My work is falling apart. I feel like I'm failing, and my kids deserve better than me.
It sounds like you're carrying an enormous amount of pressure, feeling like you're not meeting expectations at work or at home, and that is causing you to question your worth as a mother and as an employee.
Yes, absolutely.
Given everything you've been juggling, it makes sense that your body and mind are feeling overwhelmed right now and overloaded. Because your safety matters to you and me, I want to ask some questions that I ask whenever people feel overwhelmed and with you a little frantic. So, in the past month, have you wished you were dead or wished you could go to sleep and not wake up?
Sometimes, yes.
Okay. Thank you for being honest with that. In the past month, have you actually had any thoughts about killing yourself?
No, not killing myself exactly, just wishing the stress and feelings would stop.
Okay. So more thoughts of wanting things to stop or disappear rather than really ending your life.
Yes.
Have you ever done anything, started to do anything, or prepared to do anything to end your life in the past?
No, I haven't.
Okay. Do you currently have access to anything that you could use to hurt yourself if those thoughts became stronger?
No.
Okay. Thank you. Well, what I'm hearing is that you're having passive thoughts of not wanting to be here, but no plan, no intent, or history of any attempts. I'm glad you told me so that we can address it together. So I want to check in on a few other things to understand how you are functioning overall. So let's check in with sleep. How have you been sleeping lately?
Not well.
Okay. How about appetite?
Less than usual.
Okay. Any trouble focusing or remembering things?
Yes, especially at work.
Okay. Um, let's do a little mental check-in. Can you tell me today's date or day of the week?
Tuesday.
Okay. And where are we right now?
In your office,
Okay. Can you tell me your full name?
Isabella Martinez.
Excellent. And what brought you to seek therapy?
Because I feel like I'm falling apart.
And I also noticed you seem fatigued. Your posture is slumped and your voice is quieter than usual. Does that feel accurate?
Yeah.
Okay. So when stress becomes intense like this, do you ever hear or see things others do not, or you feel disconnected from reality?
Not really.
Okay. What do you think is contributing most to how overwhelmed you're feeling?
Trying to do everything perfectly, perfect mom, perfect employee, perfect daughter.
That is stressful, and that shows good insight. I'm going to ask you to remember three words for me, okay? Apple, table, and blue. I'll ask them again in a few minutes. And so before we move forward, I'd like to help your body settle a little, because when we're overwhelmed, our nervous system can go into overdrive. Would you be willing to let me do a brief grounding exercise?
Yes.
Okay. So take a slow breath in, and then out slowly. Now name three things you can see around you in the room.
Pens, a fidget, and a box.
Okay, good. You're doing well. Now, can you tell me those three words I asked you to remember?
Apple, table, blue.
Nice. All right, because you've been having thoughts of wanting to disappear, I'd like us to create a safety plan together so you have something concrete to use if those feelings intensify. So let's first talk about some warning signs. What physical signs do you notice that tell you things are getting worse?
My chest gets tight and my heart races.
I bet the heart races is scary. What behaviors do you notice when you begin struggling more?
I isolate and stop answering people.
I'm going to give you this worksheet that I found. It's actually a emotions worksheet, and it says if your emotions could talk, and really what it says is your emotions are messengers to your body, and each one of them shows up for a particular reason. So say you're feeling overwhelmed, in this box it says you're feeling this because you're overwhelmed feelings is here to show you that you're carrying too much and you need to take a pause. So doing those grounding exercises we've talked about, you can keep that is really important. The breathing exercises. Um, so we talked about emotions that usually come up. You say hopelessness and panic.
Mm-hmm.
All right. What helps you calm without needing anyone else right away?
Breathing exercises and
Okay,
journaling.
so those are good. And you're keeping up with those. Any positive self-talk or reminders that help?
That this feeling will pass.
Okay, that's a good one. Who can you reach out to when you need support?
My friend Sarah from work, she knows my struggles are.
Okay. Anyone else?
I guess my sister, although we haven't talked much recently, but I know she loves me and would be there in an emergency.
Oh, that's good. What about support groups or any community things that you attend?
My church has a women's group. I've been a couple of times and find it supportive.
Oh, that's good. Okay. So I'll just wrap this up for support services by making sure you know about the professional resources such as me, anyone in this agency. Obviously, there's the 988 crisis line that you can call and you can just talk to somebody. It doesn't even have to be for suicidal things. It can be just to talk if you can't reach anybody at the agency or me. And then, of course, if it's super urgent and you can't, all other options have failed, you can call 911. Okay.
Okay.
Are there any medications, weapons, or anything else at home that could become a concern if your thoughts worsened?
No firearms, but I do have some medications.
Would you be willing to secure those or have someone help you by holding them if needed?
Yes, my sister would.
Okay. Where could you go if being alone at home felt unsafe?
My sister's house.
Okay. So let's make your emergency steps a little clearer. We'll just review these real quick. First, you would use your coping skills, your breathing and your somatic exercises. Um, you would contact Sarah from work or your sister if you need support, need someone to talk to. You could go to your sister's house if you feel unsafe being alone at home. You can contact me or 988 or last resort, call 911 to go to the ER. Can you agree if these thoughts worsen or you begin feeling unsafe, you will follow this safety plan and reach out before acting on those thoughts?
Yes.
Okay, great. So thank you. I want you to hear this clearly. You are not alone in this, and what you're feeling is something we can work through together. The fact that you showed up here today and were honest about all your answers tells me that there's a part of you fighting for things to get better.
Yes.
Okay, so before we end, how are you feeling now versus when you first came in?
I'm much better and more relieved.
Great, I'm glad to hear that. We'll just keep building on this together. Thank you.
Mhm.